Salmonellosis, or salmonella, is an infection with salmonella bacteria commonly caused by contaminated food or water.
The two types of pathogens of salmonella are Salmonella enterica and Salmonella bongore. Salmonella is a gram-negative, straight, rod-shaped bacteria. Transmission is usually person to person or animal to person via the fecal-oral route through ingestion of the organisms via contaminated or improperly cooked foods. Foodborne transmission occurs particularly with raw and undercooked eggs, raw milk, poultry, raw red meats, unwashed salads, fruits and vegetables, grains, seeds, and nuts, some shellfish, and filter feeders such as oysters.
CDC estimates salmonella causes about 1.2 million illnesses, 23,000 hospitalizations, and 450 deaths in the United States every year. The outcome in most cases of salmonellosis is good, with a mortality of less than 5% in the developed world. In the U.S., the average annual age-adjusted mortality rate is 0.03 per 100,000 human years, with the highest rates of death in the elderly and among those with underlying conditions, such as HIV.
Salmonella was first visualized in 1880 by Carl Ebert from the pyrus patches and spleens of typhoid patients. 4 years later, in 1884, George Theodore Gatzke was able to successfully grow the pathogen in pure culture. A year after that, medical research scientist Theobald Smith discovered what would be later known as Salmonella enterica. Salmonella bongore is classically regarded as the Salmonella of lizards. It was discovered in 1966 from a lizard in the city of Bangor, Chad. It can be transmitted by touching the skin of amphibians and lizards such as the bearded dragon, as pictured here, which recently infected 132 people. Originally, Salmonella bongore was considered to be a subspecies within the genus Salmonella. However, based on DNA similarity, all members of Salmonella are now grouped into only two species, Salmonella bongore and Salmonella enterica. Species of Salmonella are closely related to E. coli, and they are estimated to have diverged from a common ancestor approximately 100 million years ago. Although Salmonella was first visualized by Carl Ebert from the spleens of typhoid patients, Dr. Salmon, a U.S. veterinary surgeon, discovered and isolated the strain enterica from the intestine of a pig in 1885.
Salmonella most commonly occurs in the United States. It is more likely to occur in the summer than the winter. Most of the symptoms you'll have from a salmonella infection will be stomach-related. These include cramps, bloody stools, diarrhea, cold and chills, fever, headache, and throwing up. Even though most symptoms usually don't last more than a week, in some cases it can take several months for your bowel movements to get back to normal. Most cases of Salmonella gastroenteritis self-resolve without antimicrobial therapy in 3 to 7 days. Antibiotics are reserved for patients at high risk for developing more severe disease or extra intestinal involvement. In this group, most cases resolve without complication.
Diagnosing salmonellosis requires testing a clinical specimen such as a stool or blood from an infected person to distinguish it from other illnesses that can cause diarrhea, fever, and abdominal cramps. Laboratory scientists identify salmonella infection by culturing a patient's sample. If salmonella bacteria grow, then the diagnosis is confirmed. Once salmonella is identified in the specimen, additional testing can be done to further characterize the salmonella. Salmonella are divided into serotypes according to the structures on the bacteria's surface. Serotyping is used in outbreak investigations to link cases of illness with similar bacteria and track them to the source.
Most people only need fluids to recover in less than a week. Severe infections may require medical care, including IV fluids and sometimes antibiotics.
There is no vaccine to prevent salmonellosis. Because foods of animal origin may be contaminated with salmonella, people should not eat raw or undercooked eggs, poultry, or meat. Raw eggs may be unrecognized in some foods, such as sauces, dressings, and ice cream. Poultry and meat, including hamburgers, should be well cooked, not pink in the middle. People also should not consume raw or unpasteurized milk or other dairy products. Produce should be thoroughly washed.
Additionally, cross-contamination of food should be avoided. Uncooked meat should be kept separate from produce, cooked foods, and ready-to-eat foods. Hands, cutting boards, counters, knives, and other utensils should be washed thoroughly after touching uncooked foods.